Hi, I'm Bill Patten, Interim CEO here at Rehoboth McKinley Healthcare System. I want to give you an update. Sorry it's a little bit late, but an update from the January 30 board meeting. This was a regular session of the board. The meeting began with the board reviewing and approving a number of reports. They had a report from the Quality Committee, the Board Quality Committee, a report from the Medical Executive Committee, and from the Medical Staff Credentials Committee. All of those reports were reviewed and approved by the board. There were not reports from Human Resources or Finance Committees. Those will be presented at the February board meeting. During my report to the board, I asked for approval of a number of physician contract issues. Our process is that I negotiate a contract with a physician, have it reviewed by our legal counsel, and then summarize it to the board, and the board ultimately has the authority to approve or deny the contract. So there were several contracts that we took to the board. One was related to our hospitalist coverage. There had been work done in the past that canceled this contract, and a contract with a firm from outside of town had been signed. After talking with physicians and looking at financial options, I decided to cancel the external contract and to negotiate with the local group of physicians. I was happy to report to the board that we were able to successfully conclude those negotiations, summarize the contract for the board, which include enhanced services, some defined metrics as far as when patient rounds will be done, that sort of thing, and then also some savings that we were able to achieve in this contract. The board reviewed my recommendation and approved that contract. There were also several contracts in which call coverage provisions, I was recommending to the board that those be deleted. The board reviewed those recommendations and again approved them. And then there was just an informational item that I presented to the board related to our sleep lab and our efforts to locate another physician so that we potentially can continue to provide sleep lab services. Other medical staff related topics, I updated the board regarding our soon to start addiction internal medicine physician, addiction specialist, let's say it that way. Dr. Khan, he will be starting mid-April, and we have completed all of the required visa immigration paperwork. So happy to have Dr. Khan come on board. The addition of addiction specialty will be a wonderful addition for our organization and the community. And one other medical staff topic, I had talked with Dr. Chris Hoover, our urologist. Dr. Hoover is one of our most productive physicians. We're so happy to have him as part of our medical staff. And in my conversation with him, it became clear that we really are at a point of his practice where we need to expand it. So I recommended to the board, and the board approved hiring a physician assistant or a nurse practitioner to work in partnership with Dr. Hoover. What this will do, it will allow us to have 5-day-a-week coverage in our urology practice. It will allow Dr. Hoover to be more efficient in that the PA or nurse practitioner can do some of the lower level services and also feed Dr. Hoover additional surgical cases. Appreciated the board's approval of that. We look forward to successfully recruiting a APP to join Dr. Hoover's practice. On the recruitment front, I had recommended to the board that we should begin recruiting for cardiology coverage. In the past, we had cardiology presence 5 days a week. Now, because of payment issues, we are down to only 1 day a week. Rather than contracting for the service, I had suggested to the board that we should recruit our own cardiologists. The board agreed with that recommendation, and so we're going to begin to recruit for 2, possibly 3 cardiologists that will be employed directly by Rehoboth, and we hope to have them on board sometime later this year. Recruiting is a interesting business, so we'll see how quickly we can be successful, but this will be a great opportunity for us to expand clinical services for our community. And then finally, related to medical staff, I talked with the board about an opportunity to, again, grow services, and it was clear that we should sit down with our medical staff and look at some scheduling standardization possibilities. So the board directed me to do that, to sit down with our medical staff, not just unilaterally make changes, but sit down and talk with them, see how we can optimize their schedules, make sure that we have a good process as far as new patients, existing patients, the time that's required for each of those slots, look at how we schedule time off, CME time, continuing medical education, and then also have a real defined process for timely completion of medical records. So the board directed me to work with the medical staff, and in the coming weeks I'll be sitting down with them and beginning that process. I also talked with the board about some of the physical assets that we have that in the past we needed, and today, based on a change in services, we no longer need. A couple of examples. We currently have a mobile clinic that's contained within a fifth wheel trailer, and we have a dually pickup truck to pull that trailer around. We haven't used those services since before the pandemic. And based on our current strategic plan, we don't anticipate needing that for the foreseeable future. Rather than letting that important asset collect dust, continue to get old and lose value, we're going to look to see if we can find someone who could put it to good use. There are a couple of cars that we don't need any longer because we're not doing home health anymore. We also have some furniture, other equipment that is excess right now. So the board authorized me to move forward to see if we can sell those things. We're going to start with our employees, and this is not bargain basement. We want to get fair market value for this. Start with our employees and then open it up to the community as need demands. I gave the board an update regarding our efforts to get caught up in paying our vendors. Because of the support that we have received from the city and the county with helping to subsidize our payrolls, we've been able to use other hospital funds to get caught up on some of our vendors. And some of our vendors have been very supportive and have been willing to accept less than what we owe them. Now, remember, we are not doing that with any local vendors. It's only vendors outside of our community. But the priority is we pay our employees first, we pay our local vendors second, we pay our medical staff third, and then we pay any other vendors with money that's left over. We've got a process now where we're paying much closer attention to the deals that we've made so that we can honor those deals, to the regular payments that we make. For example, we're now making regular payments to the city for utility bills. Still have to work on the back due amount, but working on the current bills. So while there's still a lot of work to be done, I was happy to report that we're making progress as it relates to our relationship with our vendors. Also on the finance side, I updated the board on a number of projects related to efforts to save money. One was a project that I was asking the board to approve, and that was our recommendation that we physically combine our medical surgical unit with our intensive care unit, and we want to change the name to an advanced care unit. The board approved this. It will save significant amounts of money because we'll be able to be much more flexible with how we staff the unit. Our goal was to still have a higher level of care than the normal med-surg patient, but not have the dedicated separate unit that required additional staffing. The board, as I say, approved that recommendation. We also made a recommendation to create a new category of nurse. We're calling it Flex RN. These are 3 nurses that we want to hire that will allow us to have more flexibility in covering shifts when employees call out sick, when employees are off for vacation, or when we get busy and we need additional staff. The idea is to start with 3 of these positions. The board approved this, and we will use part of the savings from the combination of the med-surg ACU to fund this project. It's also important at this point in time that we have a stable staff within our patient billing department. For us to lose any of those highly skilled employees right now would just be devastating to us. So in consultation with the department leadership, human resources, I made a recommendation to the board that we put together both a recognition and a retention program for our patient financial services employees. I hope that they recognize how important they are to us, and that it's not a huge amount of money, but that this commitment on our part shows how important they are to us, and they will agree to continue to do the hard work that's necessary to help us get caught up on our bills. We're working both sides of the equation. The expense side, the revenue side. Patient Financial Services is the one that brings the money in the door. So we wanted to say thank you to them. And then finally, in executive session, the board reviewed a number of issues that were confidential in nature, but in general terms, they were legal issues. We've been in the papers too much as far as some of our legal issues. The board needed to be updated on that. And then also strategic issues. As we're looking forward to the future of Rehoboth McKinley and how we can be a viable, stable organization, I wanted to discuss some strategic ideas that I had with the board. One of the things that the board approved after they came out of executive session was my recommendation that we hire a chief operating officer. As we look at my transition, remember, I'm only temporary here. I'm the interim CEO, but I'm trying to set the stage for the permanent CEO, and hiring a COO to assist in that process was an important step that the board agreed with. So we began the recruitment effort for a chief operating officer. If there's anyone who sees the video and knows of someone locally that would be qualified, that has healthcare leadership experience, have them give me a call. I'd be interested in seeing that resume. Hope you've enjoyed this update. As always, don't hesitate to give me a call if I can provide additional information for you. Thank you.